Bismillah ar-Rahman ar-Rahim. In this series of videos, we will demonstrate the arrangement of artificial teeth. Our guides for the setting of artificial teeth will be the occlusion wax rims. They were customized inside the patient mouth in accordance with the best aesthetic and functional needs for the patient. Now, all we have our occlusion wax rims and the recurrent bases attached securely to the master casts mounted to the articulator. Now, this articulator we are going to use, which is also used in most universities around the world, is an average value articulator, which will be discussed in details while we are arranging the artificial teeth. Now, the plaster mount should be trimmed neatly. Wash all the plaster of the articulator and never present a dirty articulator or rough, untidy mounting. A color-coded tag with the name and registration number must be attached securely to your articulator. Now, the occlusion rims are used to make 5 determinations inside the patient mouth. These determinations will be transferred via the occlusion rims to the articulator. The first determinant is the correct vertical dimension of occlusion, represented by the height of the wax as adjusted inside the patient mouth to provide the proper vertical dimension of occlusion and the proper freeway space. At the articulator, this vertical relation is preserved and protected by the incisal pin. The incisal pin is a graduated rod with the zero line in the center. And if we can notice here that we have the zero line, it's deep and a clear line. This zero line must be flushed with the upper member of the articulator and must close tightly to the incisal guidance table. Okay? Now, the arrangement of artificial teeth must not increase this vertical dimension or decrease the vertical dimension of occlusion. Otherwise, this will affect the freeway space inside the patient mouth. Now, the second determination transferred from the patient mouth to the articulator via the occlusion wax rims is the horizontal relation of the mandible to the maxilla. Now, this horizontal relation is the centric relation of the mandible to the maxilla inside the patient mouth. Now, this centric relation is securely preserved and protected at the articulator by the centric stops here, and we have the thumb screws. These thumb screws, we call them the centric stops, must be securely tightened at this stage, so no eccentric movement will be allowed in the articulator at this stage. Another important piece of information and a clue in the wax rim is the amount of horizontal distance or horizontal overlap between the maxillary and mandibular wax rims in the anterior region, commonly known as the overjet. This will be determining the horizontal amount of the relation between the upper and lower anterior teeth. It is best described by the overjet-overbite relation. Now, the overjet-overbite will create an angle between them, and this angle called the incisal guidance angle. This angle will be discussed in more details while setting the lower anterior teeth. The angle in this articulator is fixed to an average value, which is about 15 degrees at the articulator, represented by the inclination of the incisal guidance table in the sagittal plane and in the coronal plane for the lateral movement, in the sagittal plane for protrusive movement, and in the coronal plane for the lateral movements, working and non-working side. Therefore, during sitting of the lower anterior teeth, the amount of overjet overbite must create an incisal guidance angle between the upper and lower teeth equal to the inclination of the incisal guidance table at the articulator, and this can be observed by the absence of separation of the incisal pin during incisal movement. The incisal pin movement, it will not move out of the, it will not cause any separation between the incisal pin and the incisal guidance table, as we are going to demonstrate during sitting of the lower anteriors. Now, if you open the articulator, we can see the index for the jaw relation. We can remove them. Now, we no longer need them, so we can remove them. So we can watch the eccentric movements of the articulator without interference. Now, if we close the articulator, and you can see, watch, observe the relationship between the tip of the incisal pin and the incisal guidance table. In protrusive movement, there is no separation. In lateral movement, there is no separation. And when we perform the sitting of the lower anterior teeth and create the incisal guidance angle, this relation must be maintained. In this situation, we can say that the incisal guidance angle created by the sitting is exactly the same incisal guidance angle designed in the articulator. Now, the third determinants for registered in the wax rim is the labial and buccal contour of the upper or maxillary wax rims. Now, the labial contour of the maxillary wax rim will provide us with the proper lip support inside the patient mouth, and the buccal contour of the upper wax rim will provide us with the proper buccal corridor inside the patient mouth. Now, artificial teeth will be set into the wax surface, so it will give us the exact amount of lip support and buccal corridor exactly as the customized wax rim inside the patient mouth. The fourth determinant or information transferred from the patient mouth to the articulator via the occlusion wax rim is the proper placement of occlusion of occlusal plane. Now, the wax rims were trimmed inside the patient mouth to establish the proper height and orientation of the occlusal plane. Now, this is the occlusal plane anteriorly and posteriorly. Anteriorly, the orientation will be parallel to the interpupillary line, and posteriorly will be parallel to the ala tragus line. Now, this occlusal plane will be transferred to the articulator, and it will be protected and preserved at the articulator via the occlusal table. If we replace the lower cast with the occlusal table here, now you can notice that we have two slots at the sides of the articulator and a depression here. So we place the occlusal table properly in its position, tighten it securely. Now this will coincide exactly with the occlusal plane established and registered by the wax rim. Now, preservation and protection of the proper occlusal plane established at the maxillary wax rim inside the patient mouth has been secured by the occlusal table. Now, the occlusal plane placed here must have a relation with the intercondylar axis. Now here we have the condyle and here a condyle, and in between we have an axis. It's called the axis of rotation, where the mandible will open and close in an arc movement around this axis. Now, the relation between the occlusal plane and axis of rotation at the articulator must be very close to the occlusal plane at the patient mouth with its relation to the terminal hinge axis. Now we can show you the way this articulator work in this regard. If we remember together, we will have here the human skull, and you can notice that the mandible will open and close. This is the mandible in its centric relation position, and when it opens, the first 2 centimeters of opening, or the first 20 millimeters, will be a pure rotation around an axis called the terminal hinge axis. Now the relation between the occlusal plane of the in the patient's skull and the terminal hinge axis can be transferred in precise way if we use a face bow, an instrument which will be discussed to you in the future. But in this articulator, we have average value relation, as this articulator has been designed according to the Bonwell triangle. Now, Bonwell triangle, I can explain it to you here simply. If you see the mandible here, now there is a scientist called Bonwell who measured more than 6,000 skulls and mandibles. He measured the distance between the center of 2 condyles, and he found an average distance of 10 centimeters or 4 inches. Now he measured the distance between the center of the condyle and the contact points of the lower 2 central incisors, and he found the same distance of 10 centimeters. And also from the contact point of lower central incisors to the center of the condyle at the opposite side, and he found the same distance of 10 centimeters or 4 inches. So we have an equilateral triangle extending between the center of condyles and from the center of each condyle to the contact points of the 2 lower central incisors. And he designed this articulator, which is called the average value articulator, in the same way. So if you measure the center of the condyle to the center of the condyle at the articulator, it will have the average distance of the human skull, or human mandible, of 10 centimeters. And if we measure from the center of the condyle to the position where we are going to place the lower central incisors, it has the same distance of 10 centimeters. Now this equilateral triangle is called the Bonwell triangle, and this makes the relationship between the occlusal plane at the articulator and the hinge axis the same as the relationship between the occlusal plane at the patient mouth and the terminal hinge axis. Now, if we notice the first 2 centimeters of opening and closing, we have a pure rotational movement drawing an arch of opening and closing. Now, this arch of opening and closing inside the patient mouth is the same of arch of opening and closing at the articulator in this average value articulator. Now, the fifth determinant transferred from the patient mouth to the articulator is the placement of lines. Now, we have a few lines drawn at the labial surface of the wax rim. The first one is the midline, and you can notice here, this is the midline of the face. This will help us in the arrangement of the anterior teeth. Now, this midline must be transferred to the lower wax rim. We can replace the lower cast with the lower wax rim in its place securely. Now, if you close them, you can move the incisal pin a little bit so you have good access to the labial surface of the wax rims, and you extend the midline to the lower wax rim. Now, because during sitting and some repeated attempts to set the teeth, such vertical line, such vertical groove will be lost. So it's advisable that you extend the midline to the base of the cast or side of the cast, so you can have a stable reference. And you can use a ruler, flexible one like this if you wish. So the midline will be transferred to the base of the cast, and this can give you a permanent reference to the midline. Therefore, you have noticed that we have a 3-point of support for the upper member of the articulator. Now, this 3-point reference, the two condyles, we have the two condyles and the incisal pin anteriorly. Two condyles posteriorly and the incisal pin anteriorly. These 3 points establish the movement paths of the articulator and subsequently the teeth against each other. Now, teeth must not alter this movement paths of the articulator, and this can be assured and observed by following the movement of the tip of the incisal pin against the incisal guidance table during sitting of the teeth one by one. Now, you can notice, open the centric stops, and we move in a protrusive movement and lateral movement. You can notice that the pin, the incisal pin, does not separate from the incisal guidance table. Now, the sitting of teeth must not alter these paths of movement. It's crucial and important to mention at this stage that the occlusal scheme selected for complete denture occlusion, which we are going to use in our course, is called balanced occlusion. It is a unique occlusal scheme and exclusively used for complete denture occlusion. What do we mean by balanced occlusion? By definition, balanced occlusion is simultaneous anterior and posterior occlusal contacts of teeth in centric and eccentric positions. That means in static and dynamic situations. How can we achieve balanced occlusion? This will be demonstrated during the sitting of the teeth. In order to achieve balanced occlusion, we have to recognize its components. We have 5 components corresponding to the balanced occlusion. We already mentioned 3 of them: the condylar guidance angle at the condylar stops, and we have the incisal guidance angle anteriorly, and we have the occlusal plane. And we still have the compensating curves, the lateral and anterior posterior compensating curves, and we have the cusp angle. All these factors will be discussed in more details during the arrangement of the artificial teeth, and see you in the next video, and have a good time.